Welcome to my podcast. Today I'm going to talk about another case. So basically, after you introduce yourself and check the patient name, date of birth, you'll ask the patient, how can I help you today? So the patient might say that, doctor, I feel like I'm having like tiredness, fatigue. I'm not feeling myself, feeling all the time like I'm sleepy, tired. And maybe accidentally he went for just, normal health checkup. And the nurse might tell him that you have like bradycardia or your heart rate is low. I remember once I did the check for something, and the nurse told me, "Oh, your heart rate, your pulse rate is 50 something, and seems that you are athletic." And I say, "No, I'm not athletic," but so she just made me like thinking, "Oh, what's wrong?" So anything like below 60, it will be counted as bradycardia. So we need to, for instance, understand what might be the reason for this kind of condition, and when we need to investigate, and when we need to refer to the secondary care for further investigation. As we know, the normal heart rate lies between 60 to 100 beats per minute, and anything less would be bradycardia, and anything more 100 it will be tachycardia. However, it can be low or slower in young people who's fit or athletic. And the other condition can be if the SA node is diseased, or the conductive system, as we know, the AV node. And in certain situations, it could be asymptomatic, that the patient wouldn't have any issue, or can be non-specific, like feeling lethargy, fatigue. They might get syncope, or in certain situations, they might get sudden death. So, in the case of SA node, if it's diseased or there's a disorder, at rest, it will manifest with those recording, and it will fail to increase with any sort of exertion or exercise. And if it's primary heart block, as we know, there will be like progression. The BR level will be long, and the patient will be intolerable to any sort of exercise. However, in the second degree, there will be a progressive increase in the BR level, lengthening, and there's two types. And the second type, it's not associated in that regard. And the third type, as we know, is a complete heart block, and it's manifest with a very slow pulse. However, that we know, any emergency treatment of this kind of thing, it needs to follow through the algorithm from Resuscitation Council UK 2021, where they will assess, as we know, the A, B, C, D, and they will give oxygen if it's of course in the A&E, and they will access, of course, the IV line, and they will monitor the ECG, blood pressure, and the recording of the oxygen saturation, and the 12-lead ECG. And of course, if the condition is due to certain causes, for instance, that can be reversed, it should be treated immediately, like for instance, if there is any electrolyte imbalance, like in renal failure, or if there is, for instance, a case of shock or syncope, heart failure, or could be ischemia proceeding to MI, they might get atropine, IV 500 milligram. And if it's high risk systole, then you will need to give further atropine or adrenaline or isoprene, and of course you need to seek the expert in regard in order to treat those kind of cases. And usually the causes or causation could be severe hypokalemia, hyperkalemia, or there's a severe hypothyroidism, where everything will be slow. Also, in aortic stenosis, adrenal insufficiency, and muscular dystrophy. And of course, there's certain drug, including the beta blocker, which could cause low heart rate. And of course, we know that if there is chronic bradycardia, this will mandate plantation of the pacemaker, which the first time has been introduced in a human was in 1958. However, this has evolved differently and enormously recently, where it's very complicated, and even there is certain basing where it's leadless in the ventricle. So just a brief situation about bradycardia, because it's something that you can encounter, which could, of course, be normally seen in young people or athletic. However, in certain other situation, you need to further assess and investigate in order to find out the reason for that and treat it accordingly, or send it, of course, to the secondary care for further investigation in order to take it to be taken from there. I hope by that I just briefed you in general about bradycardia, and I see you on another podcast. Thank you.